You've learned a little about article types. Let's talk about the evidence pyramid. The evidence pyramid organizes types of research evidence from weakest at the base to strongest at the top. Understanding where a source falls on the pyramid helps you quickly judge how much weight to give it. At the bottom of the pyramid is expert opinion. Textbooks, clinical editorials, expert consensus statements, and clinical experience. This is the weakest form of evidence, not because experts are wrong, but because individual opinion is not systematically tested. It can reflect bias, outdated training, or limited perspective. Use it when stronger evidence is not available, but always look higher on the pyramid first. An example would be a textbook chapter on aseptic technique, or a senior clinician's recommendation based on years of practice experience. Moving up, we have descriptive and qualitative studies. Descriptive studies examine characteristics of a population at a point in time. Qualitative studies explore patient experiences, perceptions, and meanings using interviews, focus groups, and observation, essential for understanding the why behind patient behavior and informing person centered care. These studies are essential for understanding context and generating hypotheses, but they do not test interventions or establish cause and effect. An example, in depth interviews with post surgical patients exploring their lived experience of pain management and communication with nurses. Next are observational studies, cohort studies, and case control studies. A cohort study examines relationships between exposures and outcomes without random assignment. Cohort studies follow groups forward in time. Case control studies look backward from an outcome, useful when RCTs are impractical or unethical. These studies are strong for identifying risk factors and associations. But because participants are not randomly assigned to groups, these studies can be affected by confounding variables, and they cannot definitively prove causation. An example of one would be following a cohort of ICU nurses over 2 years to examine whether shift length is associated with medication error rates. Near the top are randomized controlled trials, RCTs. In an RCT, participants are randomly assigned to treatment or control groups. Randomization reduces bias and allows researchers to establish cause and effect. RCTs are the strongest single study design for testing whether a nursing intervention works. When you are asking, does this treatment or intervention make a difference? A well-designed RCT gives you the most direct answer. Randomly assigning patients to 2 different wound dressing protocols and measuring healing outcomes over 12 weeks. At the very top of the pyramid are systematic reviews and meta-analyses. These synthesize findings from multiple high-quality studies to produce the strongest available evidence. A systematic review uses a rigorous, reproducible method to identify and analyze all relevant research on a question. Meta-analyses go further by statistically pooling results across studies to produce an overall estimate of effect. When you find a high-quality, systematic review that directly addresses your clinical question, that is your strongest foundation for practice. A sample would be a systematic review pooling results from 20 RCTs on pressure ulcer prevention interventions, the gold standard for guiding clinical policy. Now that we know about the hierarchy of the article types, let's look more closely at systematic review and RTC in the next section. Answer a few questions on your left, and then continue on.